Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Adamawa State steps up COVID-19 awareness campaigns, also give preventive items to 400 pregnant women. NCDC and Nigerian Medical Institute of Medical Research, NIMR, to begin serological prevalence studies in households to generate scientific evidence about COVID-19. And it's more worries for the United States as COVID-19 deaths approach 200,000. Coronavirus cases continue to rise across the world with confirmed figures at over 31 million. The top 5 countries with the highest numbers has seen a newcomer, which is Colombia. Figures from the Johns Hopkins Resource Center shows that 770,435 people have been confirmed with the virus in the country, which displaces Peru now in 6th place. Top is, of course, the United States, followed by India. In 3rd place is Brazil. Russia is in 4th place and Colombia in 5th place. In Africa, South Africa is number 9 in the world, still leads on the continent, but recorded lower numbers last night at 725 from yesterday's figures, 1,585. In West Africa and Nigeria, the Center for Disease Control last night reported 195 new confirmed cases. Till date, 57,437 cases have been confirmed, and those that have recovered are at 48,674. The death toll is now 1,100 after 2 people succumbed to the virus recorded in 36 states and the Federal Capital Territory. The 195 new cases are reported from 10 states and the FCT, with Enugu leading at 51, followed by Gombe, 40 cases. In 3rd place is Lagos, followed by Plateau, 23 cases. The FCT recorded 15, Rivers 12, Kaduna 8. 3 were recorded in Ondo, while 2 in Bauchi and 1 each in Edo and Ogun states. 7,663 infections are still active across the country, one of the lowest in the past 3 months, while over 480,000 of Nigeria's 200 million people have been tested thus far. Now, the Nigeria Center for Disease Control, NCDC, and the Nigeria Institute for Medical Research, NIMR, and their partners are conducting household surveys in 4 states in Nigeria to better understand the burden of COVID-19 infection in the country. These seroprevalence surveys, which will be carried out in Gombe, Enugu, Nasarawa, and Lagos states, are to provide the best evidence yet on the extent of COVID-19 infection in Nigeria. According to them, the first set of household surveys to be conducted for COVID-19 Nigeria is part of the ongoing public health research activities. Later, we'll be joined by someone from the Research Institute to tell us a bit more about the seroprevalence studies. The Presidential Task Force on COVID-19 has disbursed 1 billion naira each to 32 states in the country amid the pandemic. The PTF National Coordinator, Dr. Sani Aliu, announced the disbursement of the sum during a briefing in Abuja. According to him, each state government is given 1 billion naira for the purpose of driving their COVID responses, and he says that they've been asked to prioritize testing in addition to surveillance activities linked to COVID-19.
The call for greater vigilance is underscored by the fact that our economy has been seriously affected by the pandemic, and we are pushing through our homegrown economic recovery strategies to cushion the economic impact of the pandemic. This call is made more pertinent in view of the noticeable increasing disregard for basic non-pharmaceutical measures that have proven very successful. Face masks have now turned into chin masks. Social distancing and gatherings are returning to the pre-COVID-19 era.
Now, the Plateau state government, in its efforts at flattening the COVID-19 curve, continues with another round of engagement with stakeholders to discuss strategies that will curtail community spread of COVID-19. The interactive session held at the Government House in Jos included former political office holders, senior citizens, community religious leaders, as well as the organised private sector representatives of WHO and officials of the NCDC. Governor Simon Lalong, in his remarks, enumerated government's commitment on efforts made in curtailing the spread of COVID-19. And he said that this prompted the gathering of stakeholders, that both government and leaders are on the same page in fighting the virus.
I'm sure many of you are worried by the fact that Plateau State in recent times has become the epicenter for COVID-19 cases in the country, based on data released by NCDC. This is not surprising, considering our testing capacity compared to many states who rarely feature on such chart because they are nowhere near us in terms of testing. Apart from the free testing that we carry out, we have also been consistent in treating those infected with the disease free of charge. The Commissioner of Health, who is the chairman of the subcommittee on health, will give further details on the statistics of the pandemic and how we are responding. Suffice to say, the biggest challenge remains the lack of compliance to guidelines and protocols, denials and resistance to contact tracing and testing by some individuals. That is why we need the support and cooperation of critical stakeholders like you to overcome these challenges.
The Adamawa state government has commenced campaigns on personal and environmental hygiene among internally displaced camps in the state. The government also distributed sanitary materials for over 500 mothers and pregnant women in IDP camps, calling for more safety measures amid the coronavirus pandemic. According to the government, the distribution of the items has become necessary following concerns and possible community transmission of COVID-19 within the IDP communities.
Approximately 7 months into the pandemic in Nigeria, Adamawa State is stepping up its campaign against the dangers of the COVID-19. The State Primary Healthcare Development Agency is visiting the St. Theresa's Catholic Church and Makoi IDP camps to distribute sanitary items for nursing mothers, pregnant women and children. The IDPs, mostly women and children, are out to receive their August visitors. 1 out of every 4 persons is a child at this IDP center, with about 60% of the children between the ages of 1 and 5 years old. First, the IDPs are sensitized on the importance of adhering to the guidelines of the COVID-19, especially social distancing and the use of face masks, practices which are lacking in the camps. This is followed by the distribution of the items that will help in the sanitation of their immediate environment.
And we feel that IDP camps are areas that hygiene is of utmost importance. Where you have a poor sanitary hygiene, what else can you do to support these children? So that's why we feel the diapers, pampers are very important. They help in promoting self-hygiene, personal hygiene of these children, and also to prevent them from preventable diseases that can occur from such bad personal hygiene practice.
A director in the agency appeals to the beneficiaries not to sell the items, but to use them for the purpose they are intended, even as beneficiaries express gratitude.
It is important to them. They'll use it in their children, and also we are also giving the pregnant women, they use it after they have delivered their children. So they should use it wisely, use it when they are using, they should wash their hands before using it, and also wash their hands after using the pampers.
It will really help, more especially in this issue of COVID-19 that we are in. It will really help us by using the pampers whenever our children, in the aspect of teething periods like that. I truly believe that it will really help us.
This intervention by the Adamawa state government stresses the importance of a clean environment as necessary in preventing the community spread and the transmission of the coronavirus disease amongst people living in the internally displaced camps across the state.
Now, the Nigerian Institute of Medical Research, Yaba Lagos, says it has developed a molecular test kit for COVID-19. According to developers at the Research Institute, the kit gives test results in less than 14 minutes. They call it the SARS-CoV-2 isothermal molecular assay, SIMA. Well, joining us here in Lagos is the team leader, or what you might call the inventor of Nigeria's first molecular test kit. And he is a person of Dr. Chika Onwama. Thank you so much for joining us on the program.
Thank you for having me.
So tell us, is this the rapid test kit that, we hear about?
When people use the term rapid, they often refer to antibodies and antigen tests. So we like to call it point of care. It's rapid, it gives result in less than 40 minutes. But when you use rapid, what comes to mind is antibody antigen. So for the molecular test, we kind of call it point of care. So it's near to the doctors, it's near to the hospital where they can use it. So it's rapid.
Okay, I'm also saying that you have, I think you came with it. That's all it looks like.
So that's all. And we are in making this, we had one thing in mind. To be able to decentralize the testing, it can go to as low the public health facility. Okay. Now, this is the equipment that will carry out the test. I want to carry it in my hand so you can have a sense of the size. Okay. This is what's powering it. And this can do several tests. I've done 3 tests on this. It has 6 bars and it just lost 1.
Okay.
So the thing about the assay is that it's not the routine PCR. It's not cycling. So it does not take so much power. It runs at 1 temperature. That's the isothermal. 1 temperature at 40 degrees. And it gives you results. Actually, I'm taking it as long as 30 minutes because we want to try out to get the lower ones. It just, in 6 minutes, it converts the RNA of the COVID-19 virus to DNA and starts amplifying. For some of them that were at the demonstration yesterday, on Friday, some of the very high samples, in as 2-3 minutes, you see them coming out.
Wow, it sounds
so we're just taking this as long as 30 minutes because of the low ones to see if they can come up.
So the next question is, has it been validated?
So we are in a bit of a quagmire there because our office is the WHO pre-qualification lab. Now, you develop something, it's not the best for you to test it. So we're trying to get others to test it. The second thing we're trying to do, we bought a panel from ATCC. Most people that develop assays have these panels they buy from companies. Now, they will give you the sample and say, this sample is certified to have 5 copies of this, and all that and all that. We're trying to get that to use this. So it's already been imported. We're awaiting it. And then we can use it on this, and we also send it across to labs to so help us work on it.
So you said that it is fast, but what do you mean when you say it's sensitive?
Okay, so sensitive is how low it can peak in a term, and then also if it can pick different types or strains of the virus.
Okay.
Yeah. So we'll be able to test it with all sorts of things. We are a testing lab for COVID. So we had access to samples and tried it and all that. So we're able to get it to test and get as low as 100 copies per mil. So if a sample has at least 100 copies per mil, we guarantee we detect it. Actually, it went as low as 16, but in going to 16, it jumped some that were between 100 and 16. So the one we knew would pick consistently is 100, so we stopped at 100. So we are guaranteeing up to 100. If someone had maybe 80 there, but we may not be able to get it. So we are doing things to see if we can improve the that part. But for something that is this small, that can go to any clinic or anything, it's really very good.
All right. So we also know that NIMA is partnering with the NCDC to conduct household surveys. Does this, have any plans where the prevalence serological survey is concerned?
So not really, not directly, because the household surveys are to do antibody tests. If you think of the number of people we have in the country, they say 180, 200 million. How many people have we tested? 60,000. What's that proportion? So how many people have been exposed and got well and nobody knew? So that's why we are going to households to try and find out if you have been exposed, you will have some antibodies. So we are testing them to see if they have the antibodies to COVID and get a sense of the exposure in the community, which we may not be aware of because we didn't test, or maybe they were just asymptomatic.
All right. So what are your hopes, especially for NIMA, with this latest invention?
The hope is since February, we've been working in a lot of other labs in Nigeria. There were times I would go to work and come back the next day because I don't know if you ever tried to do the test. People want it in 24 hours. People are anxious. With this at different levels, it can be done. With the configuration we're putting it, you don't need to wait for too long at the big testing centers. You can have it in your side lab. You can have people going for surgeries and all that.
All right. Thank you so much, Dr. Chika Nwama, Chief Research Fellow at the Nigerian Institute of Medical Research, NIMA. Thank you for joining us on the program.
Yeah.
We have more updates when we return. Please stay with us. The Delta State government has now confirmed that academic activities for tertiary institutions will resume in the state on or before the second day of October 2020. The Commissioner for Higher Education explains that the students will resume in phases for conformity with the COVID-19 safety protocols. He assures all students and parents of the readiness to reopen, as well as the provision of materials that will ensure the safety in line with the guidelines stipulated by the NCDC and the federal government. Meanwhile, members of staff have already resumed skeletal operations in preparation for resumption. School authorities making arrangements to ensure physical distancing is established.
We had decided far back as May, June, that if the number of reported cases, daily reported cases, plateaus off, that is, no more rising, even if it's static, if it's no more rising, we will contemplate resumption. And we actually waited to get to that point. Now it has not only plateaued off, the graph has come down. It has come down gradually. During the crisis, the height of the crisis, Nigeria was locked down. There was no movement. But gradually we eased it, we continued easing it, until now I'm at work. Now my permanent secretary is at work. The directors are at work. Level 13, 14, 15 are at work. Same thing in the institutions. So it's like we resumed work in phases. Nigeria is bouncing back in phases. So it's the same thing we are applying to the institutions. After the series of meetings, they were able to convince us that they could also resume in phases.
Several African countries are now expanding COVID-19 testing after the launch of a network of laboratories to reinforce genome sequencing of SARS-CoV-2, the virus that causes COVID-19. In Africa, 12 specialized regional reference laboratories in the network will provide sequencing, data analysis, and other technical support services to the countries where they are located, as well as neighboring countries and their sub-regions. Professor Christian Happy, Professor of Biological Sciences and Genomics at Redeemers University. He joins us via Skype to talk more about this. Thank you for joining us on the program. Tell us about the benefits of the lab network for the African continent.
Well, thank you for having me on the program. I think the major benefit is the fact that Africa can share the resources that they have. You know, not all African countries do have the resources available to do genome sequencing. And the network of labs bring together resources available on the continent so that those that have can support those that do not have and enable Africa to respond collectively to this pandemic. That's one of the major reasons why there's this network. And that's one of the reasons why, they brought together all the 54 African countries and enabled them to share the resources available in those that have in order to support those that do not have. And in the end, I think this might help Africa to respond collectively to this coronavirus pandemic.
Some have asked that for Nigeria, haven't we sequenced our genome already? Why participate in the initiative?
Well, as you know, my laboratory at Redeemers University, that is the African Center of Excellence for Genomics of Infectious Diseases, sequenced the first, SARS-CoV-2, which is a coronavirus in Africa. And this was done from the first index patient in Nigeria. So, but then, the way epidemiology is done today is done through the process of genomics, because genomics can tell you exactly where you have community transmission. You can see, with genomics data, you can see exactly the hotspot, and then you can identify places where transmission is going down. You can identify transmission you can see how the virus moves around, not just within the country, but between countries. And this becomes very critical, as a tool in order to understand not only to understand transmission of the virus, but to also see how the virus is evolving and how you can develop countermeasures for these viruses. So this is a technology that is being used all over the world and in the developed world in order to actually try to contain this pandemic as much as possible. We have that ability now, in some few countries in Africa, and then that's what the WHO and then the Africa CDC are actually leveraging in order to better coordinate, response on the continent.
Finally, how would the discoveries be used?
Well, the discoveries are going to be translated. For instance, recently we developed a rapid diagnostic test for COVID-19. This test is done within 15 minutes. And this test couldn't have been developed without our ability to cleanse the virus. We also went on and then we're very far advanced in our vaccine product. I'm sure you heard about that on the BBC News recently. And this couldn't have been done without our ability to sequence the virus, because it is when you know the genetic makeup of the virus that you can develop any countermeasure. It's not until you know that genetic makeup, you cannot develop a vaccine, you cannot develop, a drug, you cannot develop diagnostics. So that becomes very critical in order to understand what type of viruses are circulating in Africa, what type of viruses are circulating in Nigeria, and what type of diagnostics or drugs or vaccines are actually, needed in order to, contain further the viruses that are circulating. Recently, as you know, we have actually identified 10 different lineages of the viruses circulating in Nigeria. So we know exactly what those viruses look like. And that's a reason why we can actually use such a technology in order to develop the countermeasures. If we didn't have the sequencing technology and the sequencing ability, we wouldn't be able to tell you today that there are 10 different lineages of viruses circulating in this country. So, and then that's really that's definitely the game changer.
All right. Well, I'd like to thank you and wish you all the best in your research. Professor Christian Happy, Professor of Biological Sciences, Genomics at Redeemers University. Thank you for joining us.
Thank you.
Now, the coronavirus death toll in the U.S. is fast approaching the 200,000 mark. That's according to figures released by the Center for Systems Science and Engineering at Johns Hopkins University. Now, let's bring you more from the global COVID-19 update.
With U.S. deaths from COVID-19 approaching 200,000, U.S. presidential candidate Joe Biden has criticized President Donald Trump's handling of the coronavirus pandemic.
Trump panicked. The virus was too big for him. All his life, Donald Trump has been bailed out of any problem he faced. And with this crisis, a real crisis, the crisis that required serious presidential leadership, he just wasn't up to it. He froze. He failed to act. He panicked. And America's paid the worst price of any nation in the world.
According to Johns Hopkins University, the U.S. has reported at least 199,818 deaths, while the number of cases has reached more than 6.8 million, also the highest in the world. In Asia, the Chinese mainland reported 6 new imported COVID-19 cases on Monday, with no new locally transmitted cases registered. Of the imported cases, 3 were reported in Guangdong and 1 in Tianjin, Shanghai and Yunnan, respectively. A total of 13 COVID-19 patients were also discharged from hospital, while 421 people that were in close contact with confirmed cases were released for medical observation.
For further updates on the pandemic, take a look at our website. It has the latest updates on COVID-19. You can see some of the stories coming in from Nigeria across the world, and that is channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Walker. Stay healthy.